Here is our room check. Here is our MAR.
All right, I'm gonna review our patient's chart. We have Joanne Peterson, 12-10-47. She has no known allergies, high fall risk. She's here because she had fallen a couple days ago and she is just here to recover. Soreness from her fall, no broken bones. And it looks like we have a scheduled heparin due now. She had just gotten a flu shot. I'll just go talk to her, see how she's feeling, and we'll get started with our medications. Knock, knock, hand hygiene, provide privacy. Hello, how are you doing?
Good, how are you?
Good, my name's Pierre. I'll be your nurse today. Can I just verify your name and date of birth, please?
Joanne Peterson, 12-10-47.
Perfect, verifying that with the wristband. So, Joanne, we have a scheduled heparin for you. That is an anticoagulant, which is just to prevent blood clots from happening. Is that okay if we administer that today?
Yeah, that's fine.
Perfect. So that is going to be subcutaneous. I see in your chart that you have already had it before, so we'll just do it from the other side that it was given previously, and I saw it was given on your right side, so we'll do your left side today. Does that sound good?
Yep.
Perfect. I will stick around for a couple minutes after just because we have, there are some adverse effects, which include hemorrhaging, low blood platelet count, and, hold on, it's right there, hypersensitivity, which is an allergic reaction. Is that okay if I go get that started for you and I'll be right back to get that administered?
Yeah.
Perfect. Do you have any allergies that you know of?
I do not have any allergies.
Perfect. I saw that on your chart. Just wanted to ask just in case something had changed along the way. So I am going to go get that started for you. Patient's bed is in a low position. Her collar is somewhere. Fake collar. There's her collar. And bed rails are up. Gonna provide hand hygiene, privacy when I leave the room. All right, so we're gonna get her heparin started, and it is used to prevent deep vein thrombosis. I don't know if I told her that, but I told her it's for her anticoagulant. So we are gonna give heparin 5,000 units per 1 milliliter, administered subcutaneous, and it is due now. We have Joanne Peterson, 12-10-47. Heparin 5,000 units per 1 milliliter, administered subcutaneously, due now. And we're gonna double check that with our medicine bottle. We have Joanne Peterson, 12-10-47. The bottle is intact, it is not expired, just make sure I say that. And then we also have heparin 5,000 units per 1 milliliter for Joanne Peterson, subcutaneously, due now. We will go get this set up in the patient's room and we will get it administered. Knock, knock, hand hygiene, provide privacy. Hi, Joanne, how are we doing?
Good, how are you?
Perfect. I have all this stuff ready for your medication. Is it okay if I just verify your name and date of birth again?
Joanne Peterson, 12-10-47.
Perfect, there we are. Hand hygiene, I'm just gonna get this all drawn up now, so I'm just gonna turn so the camera doesn't have to. I'm just gonna get my gloves on as well, just while we can get ready.
Okay.
So we have Joanne Peterson, 12-10-47. Already verified that with the patient. It is heparin, 5,000 units per 1 milliliter, due now subcutaneously, and it is intact and sealed. No issues with that. So I'm going to get my stuff all prepped up. I have a needle. I have a blunt tip, which is what we're going to draw the medication up with. And then we have our other needle as well, but that will be after we have our medications drawn up. So I'm going to scrub the hub of our heparin bottle. Okay. And then we are going to get our needle, draw up 1 milliliter of air. We're gonna put it into our heparin, push that, and we are going to flip it and draw up 1 milliliter. So I got a bubble right off the bat. Okay. 1 milliliter, no bubbles. Move that. And then we are going to just slide that cap back on. Oh my gosh. I can't do this right now. That would have been slid on properly. I'm not even gonna deal with that right now. That's the last thing I can do right now. Okay, and then we are going to get our needle ready before we add, actually, we'll get near our patient. put this in the sharps, which is on the ground for some reason. All right, so this is all ready. I'm going to expose your stomach where we are going to be doing this 2 inches away from the umbilical cord. Does that sound okay?
Yep.
Perfect. Keeping privacy, I'm just gonna lift this up and we are going to clean this area. And then we are going to remove, we have the one, can you see it? Yeah. Move the cap. With the bevel facing upwards at a 45-degree angle, we are going to pinch the skin slightly and we are going to insert our needle, push our medication, and then remove. And then with a hard surface, we are going to shut that and dispose of it right away. And then we're just going to, perfect. Her bed's in a low position. Call light for you. I'm just gonna stay with you for a couple minutes while I clean up and just ensure that we don't have any side reactions. 15 minutes later, leave the room. Bed's in a low position, handrails up, call light, provide privacy, and hand hygiene. Document that we gave heparin.